Good morning, my name is Shannon and I am going to be talking about microneedling today. We often have a lot of patients come in with various skin problems and microneedling is often one of our go-to treatments. Here at Metaplastic Surgery, we use the skin pen for our microneedling treatments. It is an FDA-approved microneedling device for all skin types. It has a sterile tip for each individual patient that contains 14 teeny tiny needles that penetrate the skin at a controlled depth as well as a controlled rate of speed. The little tiny pokes create micro traumas in the skin, which then create acute inflammation in the healing cascade, which also then produces collagen and results in smoother, younger, brighter looking skin. Microneedling can treat a lot of different skin problems. The most common skin condition that we treat with microneedling is acne scarring. We will choose this type of a treatment over any of our lasers first for treating acne scarring. And then we can also treat fine lines, enlarged pores, a little bit of hyperpigmentation, any kind of skin texture issues at all, any kind of scarring on the face. If it's indented, then we can treat it. If it's raised, we cannot. And then any kind of aging skin as well. So it's really great for younger and older patients who have any kind of texture issues at all. Microneedling treatments are generally very comfortable. You're in the office for about an hour. We numb the skin for roughly about 20-25 minutes, and then a whole face treatment, which is our most common area that we treat, takes about 20 minutes. And really all you feel are some vibrations, and then the nose makes you want to sneeze a little bit and the forehead's a little sharper, but generally people are extremely comfortable through the whole treatment. The best things about microneedling is the quick recovery and minimal downtime. True downtime is only about 24 hours. Full recovery is about 5 to 7 days. But in the first 3 days, that's when you'll notice the redness of the skin. It'll go from red to pink to normal. Day 3 to 5 or so is when patients often notice that the skin is dry, there's a little microflaking, particularly in the areas that move the most, so around the mouth or around the eyes. And then about a week later, the skin is pretty much healed, and that's when patients will notice that the look of the skin has improved, it's smoother, it's brighter, the texture is better. We usually recommend microneedling in a series of at least 4 to 6 treatments, depending on what skin condition that we're treating. Some people can do standalone treatments if they just want a mild resurfacing treatment, something a little more aggressive than a facial or a peel. But if we're really correcting a problem, the results are progressive and they build on each other. So usually at least 4 to 6 treatments are required. If we are trying to change the skin in multiple different ways, we're trying to correct pigmentation and texture, sometimes we'll combine treatments. We can combine microneedling with BBL. We can also combine microneedling with facials or peels. And so if that's what we're doing, we are alternating every 4 weeks, a microneedling treatment and then a laser treatment, or a microneedling treatment and then a peel to achieve the skin goals. Hope you learned something about microneedling. It is a really great, easy, mild treatment that is very effective. And if you have any questions, feel free to reach out.